Your body whispers before it screams. And most people don't listen. That small ache you feel when you stand up. That strange pressure that appears and disappears. That tiny bulge you notice, then ignore. It doesn't feel urgent. It doesn't feel dangerous. But sometimes that quiet signal is the first warning of a hernia problem that doesn't announce itself loudly, but can change your life overnight if you keep dismissing it. In daily life, we're trained to push through discomfort. We blame stress. We blame fatigue. We tell ourselves, it's nothing. And that's exactly why hernias are so dangerous. Not because they appear suddenly, but because they grow silently while you keep moving. So what is a hernia, really? And what is your body trying to tell you before it forces you to stop? Let's break it down. The human body is an engineering masterpiece. Your organs don't just float freely inside you. They're held in place by strong muscle walls and connective tissue designed to withstand pressure, coughing, lifting, even sudden movements. But no structure is invincible. Over time, repeated strain, genetic weakness, pregnancy, excess weight, or chronic coughing can create a weak point in that wall. And when pressure builds, something begins to push through, usually fat tissue, sometimes part of the intestine. This is a hernia. Think of it like an old tire. From the outside, it looks mostly fine, but underneath, the structure is weakened, and one day, a small bubble pushes outward. At first, it's soft. It comes and goes. You barely notice it. But that protrusion isn't harmless. It presses on nerves. It interferes with blood flow. And if it becomes trapped, it can turn into a medical emergency. Your body doesn't panic immediately. It gives you signs. There are 4 critical ones you should never ignore. The first sign is a disappearing bulge. You notice a soft swelling in your abdomen or groin. It becomes more visible when you cough, lift something heavy, laugh hard, or strain. Then you lie down, and it fades away. That movement is key. A bulge that appears with pressure and disappears at rest is one of the most classic early hernia signs. And here's the danger. Because it goes away, people assume it harmless. But if that bulge stops disappearing, if it becomes firm, painful, or stuck, that can mean the tissue is trapped. And that requires immediate medical attention. The second sign is sharp, stabbing pain at specific moments. Hernia pain is not constant at first. It's situational. You stand up quickly. You bend forward. You lift something that isn't even that heavy. Suddenly, there's a burning or stabbing sensation, brief, intense, then gone. That pain is your tissue being forced through a narrow opening it was never meant to pass. It's a mechanical protest, not inflammation. And mechanical problems don't heal themselves. The third sign is persistent heaviness or pressure. Some people never feel sharp pain at all. Instead, they feel something dragging downward, a dull fullness, a constant awareness of that area, especially later in the day. Gravity makes it worse. Standing makes it worse. By evening, the discomfort feels heavier than it did in the morning. Patients often say, "It feels like something is pulling inside me." That's not imagination. That's anatomy under stress. The fourth sign is digestive or swallowing problems, depending on the type of hernia. In hiatal hernias, stomach contents can move upward, causing chest burning, acid reflux, bitter taste in the mouth, or difficulty swallowing. In groin or abdominal hernias, trapped bowel loops can lead to bloating, constipation, gas, and difficulty passing stool. A hernia isn't just a lump. It's a disruption of normal organ function. So who is at risk? The uncomfortable truth is almost everyone. But certain factors dramatically increase the odds. People who lift heavy objects without proper technique. Athletes who overload their core without adequate recovery. Smokers and people with chronic coughs who constantly spike abdominal pressure. Individuals carrying excess body weight. Women during and after pregnancy. And anyone with a family history of connective tissue weakness. A hernia doesn't care about age. It cares about pressure. Now comes the question everyone asks. Can it heal on its own? The honest answer is no. A hernia is a structural defect. You cannot medicate a hole closed. You cannot stretch it back into place permanently. You can only repair it. And today, the most effective and least disruptive solution is laparoscopic hernia repair. This is not the surgery people fear from decades ago. Modern laparoscopic repair uses tiny incisions, often less than a centimeter. Through these openings, surgeons reinforce the weakened area with advanced mesh technology that restores strength and distributes pressure evenly. The benefits are significant. Less pain, minimal scarring, faster recovery, lower recurrence rates. Many patients walk the same day, go home within hours, return to daily activities far sooner than expected. But surgery is only part of the story. Whether you've had a hernia repaired or want to avoid one, prevention matters. Strengthening your core muscles creates a natural support system for your abdomen. Using proper lifting technique protects your muscle walls. Avoiding constipation reduces dangerous internal pressure. Quitting smoking prevents chronic coughing and improves tissue healing. Nutrition plays a role too. High-fiber foods keep digestion smooth. Adequate water prevents straining. Probiotics support gut health and reduce bloating, lowering pressure from the inside out. These aren't small lifestyle tweaks. They're long-term investments in structural health. And here's the most important takeaway. A hernia doesn't get better with time. It gets bigger, more complicated, more dangerous. What starts as a minor inconvenience can become an emergency if ignored. Your body doesn't send signals randomly. When it whispers, it's giving you a chance. Listen early, and a simple repair may be all you need to return to comfort, movement, and confidence. Ignore it, and the consequences choose the timing for you. Health is your most valuable asset. And sometimes, a small repair is all it takes to protect it for years to come. Take care of your body. It's the only place you truly live.